With a very short answer, yes, President Obama and the Democrats can't stand health savings accounts. Actually having Americans in charge of their own health care costs. So yes, Obamacare will absolutely get rid of health savings accounts.
What does FSA stand for?
Flexible spending arrangements, yeah.
Okay.
Americans' health issues are being put into nationalized computer databases. How can the consumer avoid their private health information getting into the hands of governmental bureaucrats?
You simply cannot. You cannot.
Yeah, HIPAA was a
Stay healthy. I've been a doctor for 20, 30 years, you know?
Will the projected shortage of physicians necessitate expanding the roles of auxiliary medical personnel, such as minute clinics and allied health professionals?
Most definitely will affect the quality of care in the walk-in clinics and all these others. And you know, there's a place for ancillary, as they say, healthcare providers, but the buck should stop with the physician. And people ultimately deserve a trained physician. But there really is a place for the concept of, I can't think of the word, but I guess ancillary, but nurse practitioners and physician's assistants. They do nice jobs, but they should be working under the supervision. That's the concept of their physician, who ultimately takes responsibility. So, but people deserve to see whoever they want to see. That's the point.
Will I have my choice of physicians for any treatment in the Affordable Care Act?
No.
Wow, everybody knows the answers here.
Yeah, short answer is no. That will also go to, there are certain requirements on health plans as far as the network adequacy piece. I mean, we didn't even go into that. So how do plans start to constrict, you know, what doctors you see, the availability of doctors, their networks? That will be an issue, and that will come into play, and it will be difficult. So the short answer is no, yes. But going beyond that, you know, anything you want, going back to that whole essential health benefits and what's covered and what's not covered, and they try to fit it in a nice bucket. No, you won't be able to get see any doctor you want for any condition that you want.
You can see me. I'll see all of you. That's fine.
How different is it from Romney Care?
You know, the thing with Romney, it's not, it was very much made in the same ilk, yes. That a lot of the, down to the what we call the metal tiers of plans, where you're, you know, the bronze plan that covers 60% of your medical services, to a silver covers 70, gold 80%, 90%, the exchange type of concept for the individual market, the small group market, the individual mandate, penalty, the small employer, the employer penalty and mandate. A lot of that is very much made in that mold. However, Obamacare goes above and beyond in terms of how it reshapes payments and you know, the whole notion of this iPad. It bleeds into every sector of the healthcare system above and beyond. And I would argue too that Romney Care, you know, the problems that were illuminated with Romney Care and implementation are the exact problems we're going to see. The provider shortage is an issue. You won't be able to get to see the doctor. You know, going back to that question about seeing any doctor you want. If they're covered in network and it's your primary care physician, yeah, you might be able to get to see him, but you're going to have to wait for a couple of years because they have a schedule of patients that's you know, a mile long. But that was a real issue in Massachusetts. The other issue in Massachusetts was that the cost of this health reform far exceeded what anybody thought it would. So the revenues and all of the taxes and all of the new revenue streams that are coming into play with Obamacare, for as huge and as enormous as they are, one might argue that they're not going to be able to even hold a candle to what it's going to cost ultimately.
They're not going to ask me back here again, but I'm going to say one of the differences is I don't think that Governor Romney has the intention to want to make this a Muslim country.
If Obamacare is repealed, what will it be replaced with? And as a corollary to that, what would your ideal system look like?
Quickly, if Obamacare is government control of healthcare, government-centered healthcare, the ultimate antithesis of that is patient-centered healthcare. So we should do things to encourage that. We should allow Americans to shop across state lines for insurance. We should enact real tort reform. We should take these things called HSAs and FSAs and encourage their growth, to actually encourage all of us to be more in charge of our own healthcare costs. And we have, folks, I can't say this enough. We have to reform Medicare or say goodbye to it. Every politician in Washington knows that. Now, many don't say that publicly because, boy, they want your votes and they want to scare the seniors. But we have to reform Medicare or it will be gone really quickly.
We have to reform the American diet. The majority of people are addicted to sugar and flour and processed foods, and until there's something done on that end with ConAgra and the Monsantos, and people start learning to move their butts, that we wouldn't have the healthcare crisis that we have today. Preventative is up to us. We need to take responsibility for our health and not blame the government because we don't have enough or the right kind of insurance. When are people going to start understanding they can't be eating McDonald's and Taco Bell and all this crap you see at the supermarket, and give Jamie Oliver's a chance to get into the schools and change the diet so kids can, you know, do something more than exercise their fingers. Come on, get out there, move.
Subsidized corn crack.
Yeah, subsidized corn crack. Absolutely. It's really deep. It goes really deep.
No one would disagree with you. From, you know,
What are we going to do?
as young as you are, you understand you are what you eat.
Yes.
But you have to realize there's a big scam out there. For me personally, if your body is the temple of God, what do you think is going to work against it to try to affect you so that you're not as profitable? That's all I'm going to say.
Well, that's certainly an enlightened position, and I believe rationally true. The challenge to implement that position is that you are coming up against multi-billion dollars of corporate influence,
Right?
that are able to
Lobbyists.
well,
Yeah.
label it as much transition, but you know, it's beyond that. I mean, they, as I alluded in the slides, they really control the federal regulatory agencies, especially with the implementation of these medical procedures. That it's just beyond what you. They are very clever, very sophisticated. When you have multi-billion dollars, you can hire some very clever consultants, some of the most sophisticated consultants on the planet with respect to marketing. And they know, and marketing at a deep level, and having these front organizations that appear to be consumer-oriented friendly groups that spew absolute propaganda and nonsense that only benefits the people who hire them and in no way, shape, or form helps the public. So this is a massive challenge, and it's just really a symptom of the general decline of the health of the country overall. I mean, there's just no question. But, you know, and that's why I shifted from stopping seeing patients, because I could help people one-on-one, to help waking people up with doing the newsletter and helping, showing them, exposing this in the very media that they're having. I mean, there's real information that you can do, that you can use, that you don't have to fall into this trap. You don't have to rely on the government. So I responded earlier, what's the solution to not getting onto the government system is get healthy. Now, admittedly, that's a challenge, and you do need health coaches because everyone is individual. There's simple principles that you can apply that will radically transform your health, and nutrition is the foundation of it.
Yeah, because we gotta change.
Last question of the evening. How is this message you all gave tonight going to get around the country?
Facebook.
Well, we're going to carry a torch. You know, this is kind of, I come from, yes, I read the Affordable Care Act and I live and breathe it, but I also am very passionate about health and wellness and nutrition and really behavior change and then try to, instill that in my children. I have 2 young boys. And it really is, when you talk about the Affordable Care Act in general and the consumer education that comes with this, it's huge, huge, just on, the average individual that, you talk about somebody that's been uninsured, that's never used health insurance in their life, is always is as familiar with using the emergency room. I would suggest that that's not going to change dramatically, but it's a massive consumer education campaign. When I talked about the Affordable Care Act as far as prevention and health and building sort of a campaign around this and funneling funds to the states, and I'm very much a part of that. I'm very involved in the state's efforts on community transformation grants, the We Choose Health initiative, and I will say it's frustrating. It's exceptionally frustrating because I came from the world of the bureaucracy in a way, so I saw that other side of the looking glass, if you will, and you have a lot of bureaucrats that really believe system change and changing behaviors goes to simply putting a policy on a piece of paper and saying, there, we have a policy in place that you have to walk every day. Well, that's great, but when you leave the work site, are you going to continue to really understand what that does to you? So it's a lot of banging the drum. It's a lot of talking to people, educating, going around here and walking out and talking to your neighbor or somebody else. It's huge, and I don't have the easy answer for that, but it is very much about just building a bigger campaign and getting education and just talking to people about it, really getting them to understand. And it's frustrating, it's sometimes disenfranchising, but you just have to be your own champion and champion at all levels.
Can I just say one more word? I know it's time to go, but Dr. McCullough hit on something at the end. I just truly love Dr. McCullough's website and all the information given, and I really want to thank him for what he's doing. He mentioned health counseling. You mentioned health counseling at the end, how important it is. And 4 doctors testified to Defendant Senate Hartley in 2009 saying how important health counseling was. Yet here in Illinois, we have a Senate Bill 2936 that says if I offer an apple to somebody and say it's better than a Twinkie, I can be fined up to $10,000.
Yeah.
Now, look up Senate Bill 2936. Just think about that. Now, I'm thinking maybe we could use that to our advantage. Maybe that's something that can unite the people of Illinois. Aren't we governed of the people? Can't we stand up and do something? Can't we unite? Look, just read Senate Bill 2936. We should get together, fight that bill, and get together and show to people what's going on about our health. We're not allowed even to talk about it.
I just want to briefly add my personal philosophy is I'm a New Start physician. That means nutrition, exercise, water, sun, trust, air, rest, and temperance. Those are the things that are for your optimum health. And that's my motivation for running for office also, which is not why I'm here. I'm here because I want this country to survive.
On behalf of the American Nutrition Association, I want to thank all of you for spending your evening with us tonight and discussing this very important issue. And please join me